As a primary care pediatrician working in the pandemic and also before the pandemic for the past 4.5 years, it became really clear to me that one of the biggest unmet needs in my population of 0 to 18 to 19 to 20-year-olds was mental and behavioral health. Even before the pandemic, I was seeing a lot of kids, especially adolescents, teenagers, and young adults, who were really struggling with things like depression, anxiety, attention deficit hyperactivity disorder, trauma, and eating disorders. And before the pandemic, I was worried about these problems, but during the COVID pandemic, everything got a lot worse for many reasons that we've probably seen on the news related to school closures, economic distress, bereavement as children unfortunately lost family members and loved ones during the pandemic, and just the uncertainty and stress of living through a global pandemic and multiple crises. So when I decided to apply for an iThrive grant, it was important to me that my research questions be grounded in the realities that I was seeing in my clinical care. And for me, the obvious one was mental health in the adolescent population. So my research is twofold. I'm trying to better identify and understand exactly what the biggest mental health priorities are among our adolescents, and particularly what disparities exist. We know that mental health, while it's gotten worse across the board for the majority of children, that increase has been worse among children of color and those children who identify as LGBTQ+. This is related to many factors, predominantly the increase in some of the public homophobia and racism that we've seen, and just general levels of discrimination in our society against minoritized individuals. So we've seen these increases happening inequitably across our population. And to me, as a researcher focused on health equity, it's really important that we understand why and also what are the needs and the priorities of the populations most affected. So I'm doing this through a mixed methods approach, which means that on one hand, I'm looking at quantitative data, including chart records and other epidemiological information to better understand the burden of disease as we see it in clinic. But I recognize that not every child who is suffering ends up coming to clinic or being diagnosed with a specific mental illness. And so the other part of my question is really qualitative, meaning that I will be doing interviews and focus groups with community members to better understand what they see as the problems and how they see potential solutions. The goal is that in the long term, we can identify interventions to try to address and prevent these problems. I'm really excited because part of my research involves bringing youth and adolescents actually on as part of the research team. So we'll be doing something called Youth Participatory Action Research, where we bring adolescents into the research lab, we teach them what research is, and then we ask them to help us define the questions that we want to ask community members. We'll also share the data with them and ask them what they think about it as we plan for future interventions. My goal is that we can come up with some sort of evidence-based intervention that we can adapt and implement in Charlottesville. So it could be something in schools, it could be something in the homes, or it could be a tech-based intervention like an app. And as somebody who's interested in prevention, it's really important for me to think about wellness, mental wellness as a lifelong pursuit, just the way we think about physical wellness. And I would love for such an intervention to incorporate aspects of mindfulness, potentially medical yoga, potentially some cognitive behavioral therapy, all of the things that we know from the evidence work against depression and anxiety and other common disorders that we've been seeing in the past few years. The other thing I'm doing is that I'm part of a team that's evaluating the Compassionate Schools Project. The CSP, as we call it, is a really innovative and exciting comprehensive curriculum that's currently being implemented in elementary schools here in Charlottesville. This is the second city where it's being implemented, as it was already done in Louisville, Kentucky. And the CSP provides an opportunity for children as young as 3rd and 4th grade, and even younger, to start learning basic emotional regulation skills, like how to cope with difficult emotions, compassion for self and others, and mindfulness within their bodies, such as mindful eating, gentle movements that can help to calm their bodies down, and how to recenter and deal with stress. And we want to look over the long term to see if a curriculum like this actually does decrease the risk of mental illness later on for these children as they go into middle and high school. I chose these approaches, and I'm thinking about this in a holistic way because I've seen it work. I've seen that incorporating mindfulness along with pharmacotherapy, so medications, as well as therapeutic approaches like cognitive behavioral therapy, work. And the evidence shows us that these approaches for some people can be just as effective as medications, and when used in conjunction with other therapies, can really help to promote mental wellness and well-being across the lifespan. I've seen this in our medical yoga clinic that we have here at UVA Pediatrics, which is run by Dr. Ina Stevens, where she integrates many of these approaches into patient care. And I've seen it in my own personal life as somebody who practices mindfulness and contemplative practices through yoga, meditation, and exercise with mindfulness. And I really hope that this research, not only better defining the problems and the inequities, but also the interventions and the solutions that we can identify, will really help to make Charlottesville the healthiest place for all children to grow up, including the children who have been most unfortunately impacted by the pandemic. And I hope that we can also promote a culture of mental well-being and wellness the way that we try to promote a culture of physical well-being and wellness, recognizing that the mental and the physical are all interconnected and they're all important to leading a healthy life.